Here's something almost no cardiology appointment has time to properly and fully explain to you tonight. Every single night while you sleep, your heart is doing some of its most important work. It's supposed to slow down, ease up, and let your blood pressure genuinely rest overnight. For millions of people past 50, that overnight rest simply doesn't happen the way it should. And what you eat in the hour before bed directly influences whether it happens or not. Most heart advice focuses entirely on daytime choices. Less sodium, more walking, watch your cholesterol closely. All of that matters, but there's a piece almost nobody explains clearly in a normal appointment. What you can actively eat before bed to support your heart while it works overnight. Tonight, I'm walking you through the one fruit that keeps appearing across separate heart studies, backed by hospital research from Norway and a completely separate, independent sleep study from Taiwan. Stay with me through the caution near the end, because it genuinely matters for some viewers. It's information certain people genuinely need before making this fruit part of their nightly routine. Before we get into it, if research-based heart content like this helps you, consider subscribing and drop a quick comment below telling me your current bedtime snack, healthy or not. Let's start with something almost nobody ever explains well: how your heart actually behaves overnight. Your blood pressure is supposed to naturally drop 10 to 20% while you're asleep. Doctors call this nocturnal dipping, and it's a genuinely important, well-documented part of overnight recovery. It's one of the main ways your heart and blood vessels recover from daytime stress. When sleep is short, disrupted, or simply poor quality, that healthy dip often disappears entirely. Your entire cardiovascular system then spends the whole night working hard under daytime level pressure instead. The American Heart Association takes this seriously enough to include sleep in its core measures. Sleep now officially sits alongside diet, exercise, and blood pressure as a core heart health metric. That change came after decades of careful research linking poor sleep to hypertension and inflammation. Researchers funded by the National Institutes of Health found irregular sleep raised cardiovascular risk significantly. It's also what you're doing to your sleep quietly every single night without realizing it. This is exactly where one specific bedtime fruit keeps reappearing across completely separate research groups. Not a supplement, not a medication, just an ordinary piece of fruit most people overlook. Researchers at Oslo University Hospital in Norway designed a study around adults with mild hypertension. 50 men and 68 women, averaging around 55 years old, were split into two groups. One group ate an apple daily for 8 full weeks as a simple comparison fruit. The other group ate 3 kiwi fruits daily instead, with nothing else in their diet changed. At the end of the 8 weeks, researchers measured 24-hour blood pressure in both groups. The kiwi fruit group showed a significantly greater drop in systolic blood pressure than the apple group. Researchers specifically pointed to lutein, an antioxidant compound concentrated in kiwi fruit, as a likely contributor. Lutein may support healthier blood vessel function, which can meaningfully influence blood pressure over time. A separate study involving male smokers found similar reductions in both systolic and diastolic pressure. That's 2 independent trials in different countries, both pointing toward the same modest but real effect. But blood pressure was only half of what made this particular fruit genuinely stand out. Researchers in Taiwan ran a completely different study, this time focused entirely on sleep quality. Adults in that study ate 2 kiwi fruits, specifically 1 hour before bed, for 4 weeks. Participants in the study fell asleep faster, slept longer overall, and woke up less often. total sleep time increased noticeably. Sleep efficiency, a marker of restful sleep, also meaningfully improved. Scientists believe kiwi fruit's natural serotonin content may partly help explain some of these sleep improvements. Some research also suggests kiwi fruit contains small amounts of naturally occurring melatonin-related sleep compounds too. None of this means kiwi fruit works like a sleeping pill or replaces medical insomnia treatment. The improvements were real and clearly measurable, but modest, not dramatic or instantly life-changing overnight. Still, place both research threads side by side and the overlap becomes genuinely hard to ignore. One fruit linked to lower nighttime blood pressure in Norway and better sleep in Taiwan. That overlap is precisely why cardiologists keep circling back to kiwi fruit instead of dismissing it. So what should you actually do with all of this information starting tonight? Practically speaking, 2 kiwi fruits eaten roughly 1 hour before bed matches the amount used in sleep research. If blood pressure is your primary concern, 3 kiwi fruits daily, anytime, mirrors the Oslo study. You don't need to peel it. The skin adds fiber, though texture bothers some people. This isn't a medication replacement, and it isn't a guaranteed fix for anyone's blood pressure. It's a small, evidence-supported swap for whatever snack you're currently reaching for late at night. Now here's the caution I mentioned earlier, and it genuinely matters for certain viewers specifically. Kiwi fruit is relatively high in potassium, roughly 215 milligrams in a single fruit. The American Heart Association clearly notes potassium helps counteract sodium's effect on raising blood pressure. Most Americans consume far more sodium and far less potassium than current guidelines actually recommend. But if you live with chronic kidney disease, this same benefit can become a real problem. Damaged kidneys may struggle to clear excess potassium properly, leading to a condition called hyperkalemia. High potassium fruits like kiwi can shift from helpful to genuinely risky in that specific situation. If you're on blood pressure medication, potassium-sparing diuretics, or have any kidney concern, please pause here. This is a conversation worth having with your doctor before making kiwi fruit a nightly habit. Most people without kidney disease won't need to worry about this potassium consideration at all. But responsible health content always means mentioning the exception, not just the exciting headline result. Let's talk about why sleep and heart health are more connected than most people realize. Poor sleep doesn't just leave you tired the next day, it strains your cardiovascular system directly. Elevated nighttime blood pressure, unresolved inflammation, and stress hormones all interact during those unrestful hours. This is why cardiologists increasingly ask patients about sleep, not just cholesterol and blood pressure numbers. A habit as small as an evening snack choice sits at the intersection of both systems. Food eaten before bed can influence blood sugar, digestion, relaxation, and ultimately, sleep quality itself. Choosing a fruit with sleep-supporting compounds instead of processed sugar may be a meaningful shift. None of these nutrients act completely alone. Heart health depends on patterns, not single magic ingredients. What kiwi fruit represents instead is one small, evidence-supported piece of a much larger nightly puzzle. Most people never think about their heart working while they sleep, yet it never actually stops. Every heartbeat during sleep still depends on blood vessel tone, hormone balance, and nervous system regulation. A fruit that gently supports both relaxation and vascular health touches more of that system than expected. This is why researchers keep circling back to kiwi fruit rather than dismissing it as a passing trend. The evidence isn't dramatic, but it's consistent, replicated across different countries, ages, and study designs. Consistency matters far more in real nutrition science than a single flashy headline promising overnight transformation. Real biological effects tend to be modest, repeatable, and honestly a little boring compared to viral claims. That's usually a sign the research is trustworthy rather than exaggerated for clicks and attention. Not with a miracle cure, but with a small, low-risk adjustment worth genuine, thoughtful consideration. Swapping a late-night sugary snack for 2 kiwi fruits costs very little and carries meaningful potential upside. It won't replace medication, exercise, or a heart-healthy diet built carefully across an entire day, but it may quietly support 2 systems, sleep and blood pressure, that constantly influence each other. Sleep better and your heart works less hard overnight. Support blood pressure, and sleep often improves too. Most heart health advice still focuses mainly on daytime choices, exercise, meals, stress management, medication adherence. Nighttime remains the most overlooked 8 hours in most people's entire approach to cardiovascular health. Blood pressure, heart rate variability, and hormone regulation all shift across different overnight stages of sleep. This is part of why heart disease can feel sudden, even though it typically develops gradually. Small nightly patterns, repeated for decades, eventually surface as the health event nobody quite saw coming. Understanding this shifts the entire conversation from crisis management toward quiet, consistent, everyday prevention instead. A bedtime fruit isn't a headline-worthy breakthrough. It's a small door into a much bigger idea. The idea that heart health is built moment by moment, including moments you're not conscious for. This reframes something as ordinary as an evening snack into a genuinely meaningful daily decision. Not because of fear, but because small, repeatable choices compound quietly across months and years. Picture a patient, purely as an illustrative example, to see how this actually plays out. A 71-year-old grandmother, recently recovering from a mild heart scare, managing early cardiovascular concerns carefully. Her cardiologist noticed her overnight monitor readings looked steadier than expected for someone her age. When he asked about her evening habits, one small detail kept coming up repeatedly, consistently. 2 kiwi fruits, most nights eaten quietly about an hour before she usually went to bed. That alone doesn't prove causation. Plenty of other small habits could explain what he observed, but it lines up closely with exactly what the Oslo and Taiwan research independently found separately. Weeks later, at a routine follow-up, her rhythm looks steadier still, the habit now routine. He was careful not to credit one fruit alone. Many small changes could explain the improvement. Still, watching her numbers settle quietly was the kind of moment that kept him paying attention. She simply seemed a touch more rested, and that small shift mattered more than any headline. None of this replaces medication, exercise, or a heart-healthy diet built across the whole day. What it offers is a small, low-risk, well-supported addition worth discussing with your own doctor. Especially if you already manage blood pressure concerns, poor sleep, or general cardiovascular risk factors. This video isn't medical advice, and it isn't a replacement for your doctor's personalized guidance. Consider it a starting point for a conversation, not a final answer to individual health needs. Because your heart, your sleep patterns, and your medical history are entirely unique to you specifically. What worked in a Norwegian study of 68 women may not translate identically to everyone watching. Not a secret, not a miracle, just consistent, unglamorous evidence repeated across independent research teams. Sometimes the most powerful heart health habits aren't dramatic at all. They're small, quiet, easy to miss. If this kind of research-based breakdown was useful, subscribing helps you catch the next one. Not the promise of a miracle, but quiet, repeatable evidence hiding inside an ordinary bedtime habit.